Hi, everyone, and welcome to Crushing Doubts Q&A every Thursday at 6 p.m. Eastern, 3 p.m. Pacific. Great to be back here with you guys to talk about all of the things that we all go through from a mind-body experience, and I really do think it is the human condition. So it's good to understand that human condition. It's good to understand what's happening, and of course, the number one way that I find that it's good to learn about it or to have that information is because it gives us relief over all of those acute symptoms that pop up all over the place, and even more so, those chronic, seemingly chronic symptoms that we don't think we can get rid of. Now, of course, I was one of those people. I had 8 years of back pain. Many of you know my story, but people who join, it's good for them to hear this story that I was in that position, did not think I was going to get better for any reason. And I got caught wind of Dr. Sarno's work, and that got me started on things. But I did find that I needed more answers. And that's really what this show is all about. It is about getting you answers. To get better from a mind body issue of any kind, you've got to understand why it's happening, how to make it better. And ultimately, that's not only what this show is about, but it's what my whole system is about. So I created this thing that has become known to me and to the people I talk to about it as the column system. Where does that name come from? That comes from these mind body maps I used to do. They were on sheets of paper, and I would have people write down, I'd divide them into 3 columns, and talk about 3 different types of experiences that you can have that lead to symptoms. Each of these columns does that. One is the emotions column. That's the one that is most similar to what Dr. Sarno talks about, and a lot of people in the mind body community know that your emotional life, especially unconscious conflicts, can lead to symptoms. That's true. That's the emotions column for you. The doubt column is the place that we can look and understand at what is happening when it seems chronic, when it just won't break up, even when we are thinking emotionally. That's what the doubt column is for. And the power column is about developing a better relationship with you so that you can receive the communication of the symptoms, know what it is that they're saying, and interpret them that way. Every time we understand what the symptoms are doing, we're in a better place. We're in a place where we can control the symptoms better, not be as scared by them, and really affect change, but also learn from them. And that's ultimately what this is all about. When I say ultimately, I actually mean getting better from the symptoms, but learning from them is a big part of that. Positive Wellness, good to see you here. Kelly J. Cole has joined us on Instagram. Rita is here, and Justine, thank you so much for joining me. I was having a problem a couple weeks back, only 1 week, with comments in Instagram. So if anybody feels that they can make a quick comment, I'll know the comments are working. And we can get started with a preloaded question. Just so you guys know, when there is time, I do bring in questions that people have asked me. Sometimes they send them to me on in an email, and you can do that. It's dan@crushingdoubt.org. All right. Positive Wellness says all good. So the comments are working on Instagram. Good to hear. Thank you. Patty Girl 75, good to see you here. For people who want to send in questions, let's say you're wanting to see this, but you're in England and it's going to be you're going to be up late. Hi, Patty Girl. Thanks for saying hi. Let me know if you have questions. I'm here to answer them. So let's say you're up late, or you're in Asia, or you just aren't going to be able to make it live. You can always send me an email, dan@crushingdoubt.org, with your questions. I call them preloaded questions because I've got them ready to go, and then I bring them right onto the show. By the way, one thing that I do often like to put a plug in for is if you're looking for ways to get the information I have to give in a more complete way, the seminars are the way to do that. The pre-recorded seminars are available now. I will be doing live seminars again, but I'm taking a break from them while I'm trying to finish up the edit of this book, making very good progress. I know it's been a long time coming, but the book has to be good. It's got to give you what you need. So give me time, and I appreciate the patience everybody has about it. But the seminars are a great way to get that information. The groups are a great way to come be able to meet with me once, twice, or even 3 times a week to ask me questions. And it's a little different than this because there's much more give and take where I can say, well, now, hold on, I need to know this information to answer your question better. You get even more detailed answers there. You get more in depth. You get more suggestions. And it's a way to really practice the columns. So if anybody's interested, you can go to my website, www.crushingdoubt.org, or email me, dan@crushingdoubt.org. Here is the first preloaded question. Let me get it in here. This is from Lucille. Lucille says, I started a new birth control pill, and I'm happy about this decision, which makes me feel powerful. Good. However, I do have some fear of the side effects. I'm 90% convinced that most medication side effects are mind body, but I would love your help to crush the remaining 10%. Also, when I say most side effects, I feel that also leaves some space for doubt. How do you tell which side effects are real and which ones are just doubt/fear? My main worry relates to headaches as usual. Okay. So Lucille, thank you so much for this question. One thing that I tend to like to say when I get questions about a woman's cycle is I'm very much aware that I'm a man. And so I don't know what that's like personally. But what I can speak to is the fact that mind body symptoms are so rampant. They're so huge that there's definitely at least part of that going on in any woman's cycle. It goes on for everybody, no matter what's happening. The thing is, you can't switch off your mind no matter what's happening. So if you got your mind on, which everybody does, and you're going through the cycle, you're going to have thoughts and questions about it. And Lucille's question is right to the heart of it. How are we supposed to know which is which? Well, here's the thing. First of all, medical doctors are very good for certain things. And one of the things that they're good for, aside from catching life and death stuff, which they tend to be very good at, is to recognize what is the normal progression of a typical experience, a typical physical experience. So if there are side effects, let's say, that affect all women and are very much always there, that doesn't necessarily mean that they aren't mind body, but it does give an indication that maybe there is something more medically related to them if it's so consistent, especially across all women. However, doubt is tricky. Symptoms are tricky. They're going to climb in every space they can, and women have been given this huge canvas to paint on with doubt. Everything gets blamed on this. And I don't blame women for doing that. I don't know what it's like, and I'm sure there are tons of things that happen. But what you have to remember also is hormones are also controlled by mind-body experience. So, if you're really worried about it, it's going to spike things up. So let me get to the heart of Lucille's question. How do you tell which side effects are real and which ones are just doubt and fear? Well, the first thing is this. You can always challenge doubt. Challenge it, and if it brings the symptoms down, it's mind body. Now, the opposite is not necessarily true. It's not that if you challenge the doubt and the symptoms don't go down, that it's medical. That's not true. But if you challenge things and they do go down, you've got a mind body thing going on. Now, can there be an interaction effect? Yes, there can be. So what you want to do is challenge that. What I would do, Lucille, is to challenge these 10% remaining. Now, the fact that you have worries, especially in relation to headaches, which is your primary condition. I know this from talking to Lucille before. That to me makes it all the more likely that this is all mind body. Very, very little of it should be anything else. And I've even found this to be true with other medications, by the way. Of course, I can't speak to the cycle, but when I was getting off of a certain medication, I had taken antidepressants for a while. Never thought that I would, but I got huge anxiety, and they were help just at a particular point. It was totally a mind-body thing. I was in a panic, and I took that for a while. And when I was getting off of them, I had all these questions about the side effects, and the side effects were incredibly convincing. I was certain that there was medical stuff, and I would Google it and find out the most horrible things. And it turns out every single one of them was a side effect. Doubt was just that strong. So the place I want you to start, Lucille, is to actually assume that it is doubt. It doesn't mean it always is, but it usually is. And so I want you to challenge that. So push back at it with the assumption that it is doubt. Most side effects are. And, it makes sense actually, because if you take any medication, the mind is going to be turning and turning and turning and can have all kinds of side effects. I want to say hi to a couple people. Scotty has joined us. Hi, good to see you. And M for Meredith is here. And eBaggish has joined on Instagram too. Thank you so much for joining. And Jane Smith says, thanks again for being here, Dr. Dan. Good to see you here on YouTube, Jane. So, Lucille, I hope I answered your question to your satisfaction. You're going to have to let me know later because it was a preloaded question, but you can weigh in on that. Main idea, assume it is doubt and push hard against it. If you get results, it helps. If you don't get results, we reevaluate. We start to look at why do you believe that this is purely medical or anything like that. And we'll see. It could be that the ideas about it are by a doctor who's saying something like, yeah, for some women it happens, for some women it doesn't. That's starting to speak to doubt. It should be very consistent if it's an actual side effect. Okay, we got time for another preloaded question. This is from a different Scotty than the one we have on here in Instagram, I believe. Load it in. Okay, Scotty says, I recently had a flare that I suspect was tied to stress in the form of putting pressure on myself, being self-critical and judgmental of others. I'm trying to decipher what kind of emotion this is. I nipped it in the bud by being confident in overcoming the symptoms, having a positive outlook, and being self-compassionate. Not buying into catastrophic thoughts of the pain, quote unquote, not going away, conquering doubt. Okay, so he's saying, I recently had a flare that I suspect was tied to stress. I got to reread this again. Sometimes I read these things, and I do want you guys to know language matters. So sometimes I reread these things because I'm like, there's important stuff in here. I need to make sure I'm understanding what is being asked. So he's saying, I had a flare, and he's trying to decipher it. Now, nipping it in the bud by doing the various things that he did was extremely helpful. But what I hear is I'm trying to decipher what kind of emotion this is. So let me remind people of what to do in the emotions column. Because if there is a flare, an onset, or an uptick, that's emotions column. Remember, in the column system, you want to identify what's the primary column you're working in. Well, a sudden onset or uptick in a symptom, that's emotions column. So Scotty's trying to figure out what it was. You've got to go to the main clues. The main clues are these, just as a reminder. The timing of the symptom. The timing always matters. And it's exact. So don't start looking for something that happened 3 hours before the symptom started, and don't start looking a day after it started. Look then. The body never lies. It's telling you something was starting then. So the timing, that's the number one clue. Another way that you can get to understand what that timing means, though, is if you understand your emotional themes. This is what the emotions column is for. You are, in the emotions column, supposed to build out, let's say, 6 to 12 themes. And I'm happy to answer questions about how to do that or whatever questions you have. But you want to get themes, 6 to 12 of them. There's a reason I have that number. It's designed to give you a very well-rounded view of who you are. What makes up you? What are the things that bother you especially? There are things that make up you that don't lead to symptoms because you just love them. But the things that bother you are the ones that tend to lead to symptoms. So among these 6 to 12 themes, each theme is supposed to be connected to something very broad, first of all. I'm talking about things like mortality, self-esteem, validity, being seen. These are all really big things. Betrayal, any kind of really big picture idea that has affected you tremendously, go there. If you had a trauma where suddenly things changed and they're never the same again, the sudden change, that could be a theme. Within that broad theme, though, first of all, it has to be high stakes. You don't have any emotions that lead to a symptom that aren't high stakes, that don't really matter. We don't hide things from ourselves that don't really matter. So it's got to be high stakes. And then you can think about, well, what are the areas of my life where something like that could flare up? And I want you to think of the big areas of your life: work, home life, your relationship, your close friends, mortality, self-esteem. These are the big areas of your life. And by the way, if you need help generating these, my mind body guides have a lot of information in them. Of course, I can help if you come to groups, or if you come here, you can ask questions. But my mind body guide's also available on the website, www.crushingdoubt.org. They give these pieces of information. You can, if you look at the Mind Body Basics, it has this exact information, and the book will, of course, as well. But it's available now, the Mind Body Guides, and you can go get this information. It lists all the things to think about. And Scotty, if you want to uncover what emotion is leading to that, that's the way to go. Think about the timing, match it up with the themes. Now, let me say one other thing. Why is it 6 to 12 themes? Seems arbitrary, right? But actually, it's not all that arbitrary. And here's why. Um, I mean, I'm a therapist. I know what kinds of things tend to be upsetting to people. And typically speaking, if you've only got, let's say, 3 themes, you're probably not covering enough territory for a human mind to talk about the things that are really upsetting to them. So, let's say you have 3 themes and one is family and one is work and one is relationships. Well, what about self-esteem? What about mortality? All of these big picture things, there's at least 6 for everybody because these themes are just so major. Now, if it goes beyond 12 though, again, that is arbitrary. It could be 14, something like that, but 10 maybe. But if you go past a certain point, you start to get sub themes. And I find those are not as helpful. You want themes that are kind of all on the same level. And the reason I'm saying all of this is Scotty's asking, how do I decipher this? Well, my system is designed to help you do the things that you need to do to get answers. And so that's why I'm laying it out. Scotty, if you're watching or you watch this later, let me know if that question was answered to your satisfaction. But I do want you guys to remember the one assumption that I tell people to make all the time. You make sense and your symptoms make sense. Don't ever think that you don't make sense. Whatever's going on can be understood. And to me, that's one of the great things about the columns is that they provide a framework in which we can actually do that. Okay. We got a quiet audience tonight. Looks like we're going to be able to get in another preloaded question. This is a new record as of late. We've gotten in more before, but I will load one more in. Here we go. Okay, this one is from Chrissy. Chrissy says, if my brain knows I'm furious and angry for being in this pain, and I do anything to stop it, why doesn't it turn the pain off? It makes no sense to me that my brain would add more pain or keep the pain going when I'm telling it to turn the pain off. It seems like people can't ever get better if that's what was really happening, which is why I have a hard time believing the brain is choosing to keep me in pain due to fear or doubt. Okay, lots of important ideas in here. The first thing is this. Unfortunately, it's not that easy to just recognize that there's a connection between the mind and the body. And tell the pain to turn off. And why is that? Well, the pain's there for a reason. If you're going to disable the pain or the symptom, whatever it is, you've got to get at the function of it. So if you don't take away whatever the function of the symptom is, it has no reason to leave. Now, Dr. Sarno talked about what is the equivalent in the emotions column of distraction, where a symptom, a physical symptom, comes in to distract from an emotional experience that we do not want to know about. So what I'm hearing in this question, Chrissy, and hopefully this will be helpful to you, is you're furious and angry for the pain being there, but you don't know why it's there yet anyway. You didn't get to the emotion that led to it. So you can rage against it all you want, but you haven't gotten the information you needed to actually disable the symptom. If you want to disable the symptom, you've got to get to the meaning of it. And so when you say it makes no sense to me that my brain would add more pain or keep the pain going when I'm telling it to turn the pain off, actually, you are sending a conscious message that's running counter to the unconscious message that you are also sending. Now, I know if it's unconscious, you don't know about it, and I'm certainly not blaming you for it, but you're getting 2 different messages. That symptom's getting 2 different messages. One is switch off, and the other is keep going. Well, until they both say switch off, it's not going to change. And in fact, the unconscious one is going to be much more in charge. So you have to learn to think about things in a different way. We all have to. And we have to start thinking that it's not our conscious brains that is going to get this done. It's going to be about discovering the unconscious experience. So I understand you'd have doubt because You're telling it to shut off and it's not doing it. You're trying to believe that this is about a mind-body process. But the thing is, if you have doubt, you don't even believe it is a mind-body process. So right now, Chrissy has two problems standing in the way of that. I don't mean it critically. I mean it supportively. And I mean it as good news, because if you can identify the problems, you can do something about it. So one thing, she doesn't really know about the emotion underneath. She knows she's angry about having the symptom, but emotion about the symptom is not what it's about. The symptom is there because you're having emotion about something else. However, I know Chrissy's story well enough to know the main problem she's running into really is doubt. If you have doubt, you can't discover what the emotion is anyway, even if you're looking for it. I call that beating your head against the emotional brick wall, where you just keep going and search for the emotion. It must be about the emotion. But if you have doubt that this actually is a mind-body process, or that you can get rid of a mind-body process, or the symptom from the mind-body process, you're not going to be able to get anywhere. I always say start with doubt. So hopefully that answers the question well enough. We can certainly revisit it, not only for Chrissy, but for anybody here. And I do want to encourage you, even if you don't have your own question, if something I say in response to a question gets you thinking about something, or you need an answer, ask that. The key to getting better is questions. They are the gold standard that we have to use to fight doubt. So keep asking your questions. Okay, Zay Speaks has joined us on Instagram. Good to see you here. We've got a question coming in from YouTube. Jane Smith says, being upset from daily life stress makes my pain worse, but I feel I'm just banging my head against the emotions and doubt columns. Do I need to resolve my stressors via the power column to get relief? Okay, let's back up and start to think about this just from a columns perspective in general. So first of all, the first sentence, being upset from daily life stress makes my pain worse. Okay, now how do I read that from a columns perspective? Jane, what I read that as is that there's something going on in the emotions column because your symptoms are having an uptick. That's what the emotions column is for, onsets and upticks in symptoms. Now, I know you say you feel that you're just banging your head against the emotions and doubt columns. What I would say is, and this is a pretty familiar refrain, you're not going to be surprised by this because we've talked about this before, but I think we've got to get more specific for you in the emotions column. It's not just daily life stress. These daily life stressors all have specific meanings. As an example, if you are very overloaded, sure, that's life stress. Is that the kind of thing, though, that leads to symptoms? It's actually not. I'll tell you why, or how to think about it differently. Let's say, this is just for the sake of argument, I'm not saying this is the right one, but let's say that you're thinking, I'm just overwhelmed and that's causing stress and that's leading to pain. Well, I would say to you, there's something more specific happening. As an example, maybe you're overwhelmed because nobody's helping you even when you tell them that you need help. Now, that's a more specific problem. I ask for help and I still don't get it. People who are supposed to care about me don't care enough to respond. Again, Jane, I'm not saying this one applies to you because I'm pulling it out of thin air, but I'm trying to show you that that's so much more specific. So if you feel you're beating your head against the emotional brick wall, that's something that can happen for people when they've really, really looked at these things. They're getting very specific, still not getting results. But your profile is all pointing towards that the emotions column just needs to be honed more. Because first of all, you're dealing with onsets and upticks in symptoms. That's an emotions column problem more than a doubt column problem. Secondly, if you're not specific enough, it just doesn't get the job done. So my guess is you need some help getting more specific. This is the kind of thing that I work on in the groups. People come in, they say, I'm not sure I can get at it. Actually, I did it even with Scotty in the last question, even though he's not here for the feedback. If you were here for the feedback, I could actually have a dialogue with him, just like I do in group, and say, okay, wait, hold on. Now I've given you that information. Then he would go the next step, tell me some of the things, and I'd say, okay, it sounds like it's this. Does that feel right? We have a back and forth, and it happens very quickly. So I do really want to encourage people. You can get good answers here at the Q&A in terms of the basic answers. You can get a very specific answer. But what you can't get is the give and take that gives you multiple answers that give you a lot of room to understand what is happening. So that's what I'd want to do ideally with you, Jane, is to sit down and say, okay, now wait a minute. Did what I just say have anything to do with something that could be bothering you? And if it doesn't, then I could throw out other possibilities. Or you could say, here's the kind of thing that I get upset about, but I don't understand why. The give and take that happens, that quick back and forth that happens in group, it's just different. And I think, Jane, I don't want you suffering. I'm not, trying to sell anybody on the groups, but I do want people to get relief. And the groups offer something different. So something to think about. Now, that's how you might deal with things about banging your head against the emotions column. But the doubt column, I think, is partly as strong as it is because the emotions column isn't yet bringing about relief, and it seems like it's supposed to. So try to keep in mind that the doubt column, it gets stronger or you have more issues in it when you're not getting answers or when you're not getting results. What I want to encourage you is if you're not getting results, there's a reason. Come back and ask. This is exactly what you should have done. Jane came back. She asked a question. So I'm telling you, now I understand why you're not getting it. Now, interestingly, I didn't even get to your actual question, which was, do I need to resolve my stressors via the power column to get relief? Ultimately, in my experience, everybody needs the power column in some capacity. Everybody needs all three columns. We're built in a way where these columns just describe who we are. You're going to need the power column, but do you need it now? No. I wouldn't go there yet. I mean, you can go there. I'm not saying don't, but I'm just saying everything about what you're saying is speaking to an emotions column issue, and I want you to go there first. Jane, let me know if that answers your question to your satisfaction. If not, we keep at it. Okay, Rody Jangles has joined us on Instagram. Good to see you here. And let's see if we have other questions. No. Okay, I'm going to go to another preloaded question. All right. Give me 1 second to get this loaded. All right. This one is from Paz. I am 30 to 40% better after reading Sarno's book, but doubt and fear is keeping me stuck. My question eventually boils down to one question. I was diagnosed with moderate degenerative discs in L4, L5. I don't know. It looks like, L5 was in there twice. S1 without herniations or bulges. This diagnosis literally put me in shock for 3 days. It felt like I was in a nightmare and that this wasn't real, which actually in some ways it isn't. It is real physically, but it's not real in terms of what's happening. I'll get to that in a second. So this really buried itself deep inside my core belief. So my doubt and question is, what if Sarno is wrong and it actually is the moderate degeneration? Is there more to that? Yes. Hold on a second. Is the moderate degenerations? Hold on. I'm going to load the second part of the question. Sorry, guys. I thought it was all in one. Okay. So what if Sarno was wrong and the moderate degenerations that is causing my pain, and I will never get pain-free and will always have to live like this? Okay. First, I'm going to start right at the beginning. The very first thing that I say when I hear any situation that I'm totally clear about as being mind-body, I tell people, you do not have to live like this. You're not stuck in this. Sarno is right. But now I'm going to tell you why. Okay, so I don't just say it and I'll tell you why. If I just say, oh, it's just mind body and it's fine, that's reassuring and it's great, but you need to believe it. It doesn't matter if I believe it. So let's get to why. First of all, there are countless studies in all of the best journals in medicine, the New England Journal of Medicine, JAMA, a bunch of others as well, and they all show that these supposed herniated discs, bulges, whatever there is in these discs, never has a correlation to pain. That's what the science says. So, Paz, if you're worried Sarno might be wrong, then you're worried that science is wrong. You're worried that the top journals in medicine are wrong. And you're thinking this one doctor who told you that is right. Now, I understand that if you're faced with somebody who's supposed to be an expert and probably even means well, a lot of the doctors do mean well, most of them. But you've got to keep in mind, all of medicine has gone awry on this one. They're very good with lots of other things, but they are not good with this. And their own science shows it, and even they have admitted it. In 2017, I believe it was, the American College of Physicians released a statement saying all of these things that we thought caused these issues, these structural causes, turns out not to be the case. They don't have a correlation, and you need to seek alternative treatments. And included in those alternative treatments was psychotherapy. They are aware that essentially this is an anxiety driven condition. This is an emotion driven condition. So you're saying, what if Sarno's wrong? Well, we have no indication that he's wrong. All of the science says he's right. All of the results say he's right. If you look at all of the people who have chronic pain or don't, generally speaking, the people who get out of chronic pain get out of it for two reasons. One, they read about Sarno or some other mind body person gets them the information and they get better. Or two, there's a placebo effect. Now, I understand I can't necessarily prove that each and every time. There's a lot of different cases. But I do know the power of the mind. The power of the mind is represented in science and logic and literature everywhere. It's so powerful that it doesn't make any sense that it's not causing some things. We know that the placebo effect is real. It's in every study that's ever been done. It's just not taken seriously. It's treated as a kind of novelty act. But the placebo effect is proof of something. It's proof that the mind's belief alters the body, even when it's not true, let alone when it is. So there are people who've gotten better, let's say from a back surgery. But I will tell you, from my own point of view, it's not the back surgery that did it. It's the belief that it would help. Because there's also an even larger number of cases who got back surgery didn't get better. Is that all from belief also? It's hard to say, but we can say there's a very, very striking correlation between people who believe and who get better, especially from things like this, where there is nothing going on. Everything heals in the body. Every injury, you break a bone, it gets better in 12 weeks tops. Even nerve damage, better usually in 12 weeks tops. Most broken bones, 6 to 8 weeks. Sprains, even less than that. So everything heals. My question to you, Paz, is I understand why you'd be worried. That's natural. Everybody has things like that. But let's make the doubt work harder. Why should we believe what it's saying? Why should we believe what if Sarno's wrong? Everything points in the direction that he's right. The only thing that doesn't point in that direction in this story is that a doctor gave you that diagnosis. So here's my question to you. Is it possible that the doctor is just completely wrong and not up on his science and doesn't understand this? And the answer to that is not only yes, but definitively yes. It happens all the time. I hate that it happens, but I could put you in touch with some of the best mind-body doctors in the field, and they'll all tell you exactly what I told you. Howard Schubiner, David Schechter, John Strax, Dave Clark, David Hanscom, Ira Rashbaum. I could go on and on and on. Elisa Batson. There's tons of names. These are all doctors in the mind-body field who completely agree with me. The scientific journals agree with me. I'm not saying it's me, like I'm the one who carries this, but they agree with all of us. So don't take it too seriously what one doctor says. People say things that are wrong all the time. We have to do a very good job being our own scientists and asking, is this person saying something that aligns with the rest of reality? It's very possible they don't. It's amazing how convinced they sound. They say, oh, well, you've got this and it's going to lead to this problem. People have been told all kinds of wrong things. In fact, I just came across something. This is really interesting to me. So Anthony Burgess, who wrote Clockwork Orange, apparently he wrote that book after a doctor told him that he had a terminal brain tumor, which turned out to be a misdiagnosis. Now, that kind of misdiagnosis, that catastrophically wrong diagnosis, that usually doesn't happen. But he was so changed by this experience that he went and wrote 5 books in a year. And one of them was A Clockwork Orange. And it all came from his sense that he was living an altered life. And I don't blame him that he believed this doctor, but first of all, get a second opinion. Secondly, get a second opinion from somebody in the mind body community. To me, a doctor who doesn't understand even just the basic idea of the mind body concept is one that's going to be a dangerous one. Not dangerous from the vantage point of diagnosing life or death stuff. They're very important for that. Always trust your medical doctors about that. You can also trust your medical doctors about general timeframes of recovery or typical experiences that are usually the case. Like when I was talking about Lucille's question about the menstrual cycle or woman's cycle. Doctors can tell you what is pretty normal and expectable. What the doctor said here to pause is not normal and not expectable. That's not what happens to a lot of people with this. So that's faulty information. And we have to push past that. We've got to ask ourselves to go ahead and question, is this person right? I know how scary it is, but Dr. Sarno, we can trust. The guy was a genius, a great person, and above all else, as the reason we can trust him, he was a great scientist. He did not throw out any information. I don't know, if you weigh Dr. Sarno's ideas versus this one doctor who said this one thing, why does this one doctor say this? I mean, the burden of proof is on the other side. That's how I think about it. I'm curious what you guys think about it. Bayer Maggie, it's good to see you here on Instagram. Thank you so much for joining. Okay, once again, we got a really quiet crowd tonight from a live question perspective. I'm cooking through preloaded questions in a way that I haven't in a long time. But I have a backlog of them, so that's probably for the best. Okay, this one comes from Melissa. Here we go. Let me make sure I got it through the whole thing. So Melissa says, I get anxious about my back pain, for example, and worrying that because I fell hard on my sacrum tailbone when I was like 9 or 10 years old, that it's damaged. My MRIs don't show damage, but my low back has been tender and had issues since primary school. And I've had practitioners tell me it's because of that fall. Do you not think that would be the case? This sort of thing heals with time? Okay, great question, Melissa. Yes, I'm 100% certain that the fall that you had when you were 9 or 10 years old did not cause any kind of damage that is still going on now. That sort of thing heals long before then. However, that was a trauma of sorts. It stuck with you. And so I would say that one thing that we consider is that all these years later, that event is still looming large, but it's because of your belief about it. And I believe you, of course, that your low back's been tender and you've had issues and things like that. Remember, these things are happening in the body. They're real. Everything is real. Nobody's saying that it's not in your body. The question is, where's it coming from? And we have to remember, this is my rule of thumb. If the body is capable of doing it, your mind-body issues can use it. Whatever the function is. Every function you have, your mind can co-opt it. And so Melissa's got this idea, okay, well, I've got pain there. Well, the pain's not going to go away if doubt doesn't go away. That's the whole point of crushing doubt. If you go on having the same beliefs, then you go on having the same bodily mind, you have the same mindset and the same bodily experience. Your physiology, in other words, is determined by two things. One, what happens in your actual physiology for a variety of reasons, and what happens in your mind. And the most powerful one, generally speaking, on a day-to-day basis, is your mind-body experience. Think about it from the vantage point of if you get chased by a lion, your whole physiology changes instantly. Well, if you think that you have a back problem that you're never going to get better from, that's maybe a slower moving lion, but it's still a lion. It's going to convince you that you're in trouble and you're not going to be okay. And your whole physiology is going to change with that. Debbie Gladstone, good to see you here. Thanks for joining us. Positive Wellness says, can there be a delay in a symptom flare? For instance, Noticing an increase in baseline pain following a stressful discussion or situation. And by delay, I mean the flare happening the next day uh, versus happening immediately in the moment or shortly thereafter. Okay, there's more to that that she's typing, but I'm going to answer the question to start with. There can be a delay in a symptom flare in a sense, but generally speaking, that delay is more perceived. And here's what I want to say about it. Um, a lot of times we cannot be aware of what's happening, but we have a symptom response right away. A good example of this is kind of numbness, a freezing. The chances are what's more happening is that you had a kind of freeze that didn't allow you to process it in the moment. And from that point, there was a seeming delay. But if you think about the freeze or the numbing as the first symptom, there was no delay. It happened right away. So I encourage you, go back and think, now, wait a minute, was I actually the same from that point forward? Or did I have some brain fog? Did I feel kind of detached from my emotion? These can be very, very subtle symptoms. So there is almost never going to be any kind of delay in a symptom flare, and unless it's a seeming delay based on these things. The one caveat I'll say to that is that there can sometimes be a delay when you didn't quite realize what the information meant. So if somebody said to you, I'm mad at you and I'm not going to talk to you, and you thought, oh, okay, big deal. They'll get over it. We've been through this before. But then you realize the next day, I think they're mad in a way where they're not going to talk to me at all. The moment when you realize it, that can lead to a flare. So it's really about, when did we become aware of the problem? And by aware, I don't even mean consciously necessarily. You could be aware of it unconsciously and go numb right away. Other times you could truly not be aware of it, even with it having been said right to you. And then when it hits you, boom, that's when it comes in. Okay. Following up on that, logging pain flares has revealed an increase in pain about a day after. Okay. So that's interesting. Positive wellness. And that could be about a couple of different things. One, it could be that, first of all, it could be a conditioned response. You're now starting to believe, well, that seems to be what's happening. But if that's the pattern, that suggests that there's not a delay, that really you're just not recognizing the symptom that came first. The numbness, the brain fog, the detachment, and it could be very, very subtle. So I want you to keep focusing on the timing. The timing still does matter. I think this is kind of a red herring. However, if it persists, it could be that doubt is trying to mess with you here. And it's saying, I don't know, this comes later. Doubt's always trying to throw us off the scent in all kinds of ways. Positive wellness, let me know if that makes sense of your question, answers it to your satisfaction, etc. There's much more to say about any question, and I'm happy to answer it. Okay, Jane Smith says, thanks, Dr. Dan. Do you think relief from using the emotions columns ultimately comes from specificity, calming down the nervous system? Where would things like somatic tracking fit into the columns? Okay, so I've never been, I see positive wellness said, I get it. Thank you so much. I'm glad that helps. And please do let me know if you have follow-up questions to that, either today or another day. So, okay. The nervous system calms down when we feel safe. It's just that simple. The reality is if we don't feel safe, our nervous system is all revved up. So the emotions column and that specificity, it makes us feel like, yes, we can understand what is happening and we get better. So that's part of it, but it's not just that. I don't want people to think it's just about calming down the nervous system. It's also about the fact that you are removing the function of the symptom. As soon as you get that specific knowledge, the distraction isn't needed anymore. So calm nervous system or not, boom, it's done. Both are important. Good to calm the nervous system. Knowing what's happening calms the nervous system down, but that's more of a doubt column solution. The emotions column solution is a more direct route in this case, where you take away the need to distract from the emotion because you've discovered it and it's gone just like that. So in terms of somatic tracking, Somatic tracking is about being aware of parts of your body, at least as far as I understand it. I'm not trained in it, but I do understand the basic concept. And paying attention to what's going on in your body, to me, the way I think about it is, okay, let's track that, but let's use that to understand then the timing. Let's use it to understand how it fits with the themes and get to a place where we can understand what it's all about. So, somatic tracking usually is related more to calming down the nervous system and that sort of thing. And I think that's useful. But the reality is, the emotions column is just a different thing. Um, Calming down the nervous system is a nice thing, but the emotions column is about learning about what's going on with you at that moment so that the distraction isn't needed. Jane, I hope that is helpful. Please let me know. I'm going to finish up on this question tonight. This is from Siraj Singh. Good to see you here, Siraj. Hi, Dan. I had healed my 10 years old chronic back pain, but got into a bad flare up and it is sticking around for 3 months. Same curable exercises and PRT exercises are not working this time. I know I have lots of fear and anxiety around pain. Any suggestions or tools, techniques? Thank you. Okay. First of all, I totally understand where you're coming from. That can be a very scary thing, especially that second time through where you're like, "Oh man, I have to deal with this again." And you start to think, "I don't know, will this get better?" All that sort of thing. Siraj, you will get better. The things that helped you before, they helped you for a variety of reasons. Why are they not helping now? Well, I think you have more doubt this time. And why do you have more doubt this time? If it helped you the first time but isn't helping you this time, you're naturally going to think, what's wrong this time? What's different? And the reality is, nothing's different except your belief system's different now. You are dealing with a different problem. This is the second time around with some things, and you're starting to doubt it's going to work. So the first thing I would say is, don't worry that the things that were working before aren't working now. It just means you have a different belief system going. You said, I know I have lots of fear and anxiety around pain. Well, here are some suggested tools and techniques. First of all, coming to the groups will be particularly helpful because I can help you walk this through many times, or taking the seminars. But just as a quick tip, one thing I want you to think about is that doubt can be understood. So what you need to do in the doubt column is what I call observe, articulate, and then counter. Don't worry about counter too much yet, though. Focus on observing the doubt, recognizing that you're having doubt, and especially in your case, since you're already really well versed in doing this, articulate this doubt. We've got to get it put into words. Why do you think it's not getting better this time? Why do you think it's not going to get better this time? What do you think is going on? Get that put into words, and we'll know what we're dealing with. Then we know what the problem is. Then we can counter it, but you can't counter something that hasn't been articulated. So Siraj, let's get this put into words. Why do you think you're not going to get better this time? Now, we won't be able to do it tonight, but I want you to start to write that down. Start to write down, what are your doubts about this time, and bring them back next time if you're willing to, or meet me in the groups, whatever you want to do, or send me an email, dan@crushingdoubt.org. We can get answers to this. There is a reason it's different this time, and it's gone on 3 months now. So that's not emotions column. So Siraj saying, because it's taking very long, and I get it. But even so, why do you think it's taking so long this time? She says, I'm feeling very overwhelmed, anxious, sad. I live alone, makes it so difficult. My heart goes out to you, but you're not going to stay stuck this way. We just need to get you the right information. I really encourage you. Let's do a deeper dive into this. These Q&As are great, but when people come to them, they can ask a couple questions, and they may not get the interaction with me they need, or the information they need fully. Don't hold back on getting you the information that you need. So Siraj, I would say, send me an email. Let's discuss this. Let's discuss how I can help you. It's dan@crushingdoubt.org. Okay? All right. Sounds good. Siraj says she's going to email me. I'm glad to hear it. Okay. Jane Smith says, thanks, Dr. Dan. As usual, lots of food for thought. I'll keep working on things. Okay, Jane, same goes for you, though. And listen, I know money may be an issue for certain things, time, all kinds of things can get in the way of feeling that you can do the things you need to do to get the relief. But whatever you do, get your answers and try not to leave yourself stuck on the sidelines too long. You need answers, and the sooner you get them, the better. In any case, it has been a pleasure being here with you all tonight again. I look forward to next Thursday. We'll be here the same time, 6 p.m. Eastern, 3 p.m. Pacific. And keep up the good work. We're going to keep relieving symptoms a column at a time, a person at a time. Eventually, we're going to change the whole conversation on this because we really are right. And we'll keep that going. Thank you so much for joining me here. And I will see you guys same time next week. Okay. Thanks, Rita. Bye.